Hello, and welcome to Hospice Insights, the Law and Beyond, where we connect you to what matters in the ever-changing world of hospice and palliative care.
Jason, Carey, I'm so excited that you're here to join me. You said yes. This has been like in the works, I feel like, for 3 years, perhaps. Or maybe Carey and I were just braining this out for the last 3 years. And then we roped you into it, Jason.
I'm happy to be here.
COVID happened in between.
Yeah, exactly. So, well, this is our first conversation under this title, Successful Hospice Leadership. And what I'm doing in this little series is talking to CEOs and then, their partners within the organization and relationships, because I really feel like relationships are what drive a business and the quality of that relationship. So if you have quality relationships and trusted relationships, that's going to really be a foundation for thriving as an organization. And knowing you both as long as I have, you sort of are on the tippy top of my list of thriving relationships. And so, because the relationship between a CEO and a compliance officer is, as a compliance officer, you sometimes have to deliver bad news and things that make your CEO uncomfortable and sleepless nights. And so I thought it would be great to kick this series off with the two of you, because this is probably the most heartburn-inducing relationship that there is within a hospice. So, and you guys have done a great job of navigating that. So just to set the stage here for folks who are listening who don't know you, maybe Jason, I start with you, and this is the second time you've been on the podcast, but for those who don't study every episode, Jason, tell me a little bit about who you are, how you came to Avow, what's your background in hospice, all that.
Thanks, Megan. And thank you for having me back a second time. I guess that means I wasn't terrible the first time, so I should feel flattered.
Oh, you're awesome.
So I'm Jason Rowe. I'm the president and CEO of the Avow companies located in Southwest Florida. And essentially, I think like many of your guests, we started as a not-for-profit hospice organization over 40 years ago. And over time, kind of morphed and expanded some of our different offerings, including our palliative care, which is a separate company, as well as everything we have for grief and bereavement for adults as well as children. We also have a thriving foundation, which really helps us in terms of all of our unfunded or underfunded programs and services that we provide to the community. So I've been lucky enough to be here at Avow now for 8 years. And during that time, Carey and I have worked together for most of that time in one capacity or another, because Carey has worn a lot of hats during her 20 years here at Avow, which certainly is extremely valuable because her knowledge across the spectrum of hospice, palliative care, or just in compliance in general is really helpful. But I actually started my career probably 20 years ago in Central Florida at my first not-for-profit hospice organization. I've continued on, and this is my fourth not-for-profit during my career. So extremely happy with kind of taking this turn and getting into hospice and palliative medicine, and really very happy to be here at Avow because I have great colleagues like Carey and the rest of our executive team, all of our staff and volunteers, and of course our board.
Yeah. So Carey, you've been around the block a bit.
I have.
So, because you're a clinician by training, right?
Mm-hmm. Yep, I'm a registered nurse. I started my career in nursing and then moved into management and compliance and quality from there.
So, and were you always in the hospice space? I mean, Jason just said you've been at Avow for 20 years. So were you a hospice nurse?
Yeah, the majority of my career has been spent in hospice. I started in the hospital and it just, it wasn't the right fit for me. I actually thought maybe I don't want to be a nurse. And I found hospice and it just fit from the beginning. I was a clinician in hospice. I've held many roles, and Avow is the second hospice organization I've worked for, and I've been here 20 years. And during that time, I've done just about anything a nurse can do. And I have to say, I am extremely blessed to have had that opportunity because I found every one of those roles very rewarding.
And I think to have street cred as a compliance officer you need to understand, like, I've done your job or I know
Mhm.
what's involved in that, because compliance can also be a lonely job. Like, no one ever wants to talk to you because, again, you sort of are the grim reaper, so to speak, and like usually when compliance is involved, something's not going right, and
Sure.
like people get nervous about that. So
Yeah, I think in many times that's the case, but at a vow, compliance is involved from the ground up. It's part of our culture, and Jason has really promoted that, and it really is something that is in the fabric of the organization. And so, when no one ever thinks it's odd when compliance has a seat at the table or does come to them, because we always have a seat at the table, which is really helpful. The relationships are already there. So when there is a problem, we can easily work together. And it has been helpful to have done the job of many of the people that I work with. It does give me the ability to understand where they're coming from, especially with all the different programs that we use and just some of the challenges that we face. So when you come across to someone and you're talking to them, to be empathetic and to be able to get your message across in that empathetic way, but to do it compliantly, and they understand that at the end of the day, and this is part of the culture too, we're all here for the patients and families, and everything that we do is to their benefit and to provide that high quality care so that we can continue to provide it. And we only, as Jason says often, we only get one chance to do it right, and we really strive to make the time someone has with us here the best it can be.
yeah, no, exactly. And I think the wearing multiple hats, when we were preparing for this podcast a bit ago, you used this quote about relentless reliability. And I feel like as both an observer and a participant in, good partnerships. I mean, good partnerships are based on that relentless reliability, because we're going to talk about how you build trust. And I think trust is built not on, oh, sure, I'll do that. It's like, sure, I'll do that. And I get it done and I get this done. And, your trust is earned, I guess. And so when you use that phrase, Carrie, it really was a jumping off point for me. And I shared that with my team too, about that, because I think that was sort of how I became to be too, is
Mm-hmm.
you're always the reliable person. And so the fact that you've worn so many hats, Carrie, within the organization, I think is probably a testament to that relentless reliability. And Jason, I'm guessing you're thinking, yeah, Carrie's been so effective in so many different ways. Why did you decide to say, Carrie, let's have you double down in compliance?
Well, it's interesting. Carrie actually said that to me, and it was probably shortly after I started. Carrie scheduled an appointment to go out to lunch with me because she again was very skilled already in compliance, but we were kind of retooling what our C-suite looked like in terms of what the different structure would be, what our downlines would look like, and ultimately trying to prepare for the next 5, 10, 15 years, because this was back in 2015, knowing that there were kind of these monumental changes coming. And so, when we sat down for lunch, she kind of shared her thoughts and very quickly also was thinking about the future and understanding what was going to happen with all of these government audits, quasi-government audits, and all of these different functions that really 20 or 25 years ago, none of us ever heard about in terms of all of these different things. There was no even vision, I think, of the whole a TPE process way back then. And it was kind of, to a certain degree, everybody left to their own devices when the majority of hospices were really not for profit, and we weren't on the radar of the government and so on and so forth. And with the times changing, I think we knew that we not only needed to be prepared for all of that and continue to be a compliant organization, but really, I think to Carrie's point, have compliance be part of the fabric of what a vow is. Not only compliance, but also quality. And you don't have good quality without compliance, which we've all
Yeah.
heard multiple times. And so that was really kind of the beginning of trying to build this and make sure that everything that we're doing and everything that we're thinking about doing all starts with the basis of quality of care and compliance, really as the foundation for it. And whether it was redoing some policies and procedures or looking at our code of ethics or looking at how we respond to audits or all the different things, that's really somewhat kind of, I guess, esoteric to us. It's what Carrie does an exceptional job of. And when we're speaking to our peers here, whether it's the C-suite, the leadership, or even our team, or with the board, she does it in a way where it's relatable. They understand not only why it's important, but the impact of why we're ready for this, which is exactly what I try and do, probably at a macro level for everything, including all the upcoming changes that are happening with Medicare and all the things that we're expecting to happen just with the healthcare continuum in general.
Obviously, someone taking that initiative totally doesn't surprise me that Carrie's like, hey, let's go out to lunch, Jason. I have some ideas I want to share with you because, and one of the reasons that I really value the relationship that the two of you have from a distance is, Carrie, you obviously have a lot of get up and go and passionate about what you do and this whole idea of learning more and building your skills, because compliance 10 years ago in hospice and what compliance looks like now, totally different, right? And so I know you did a lot of investment from an education standpoint, and maybe you can talk about what that looks like and how Jason supported that.
Sure, that'd be great. Eval has always supported education, and that is something that Jason has very much promoted. But from the time I was an RN, at some point, maybe about, I guess, 15 years ago, I decided that I wanted to go into leadership and went back and got a master's in administration, healthcare administration. And I started working in leadership and then moving up into other areas and started actually in quality. And when Jason came, he really made it a point of promoting education, not just at the degree level, because the degrees and the certifications are important, but also in the networking development piece, which I think it's been a key in my development and a key in success in the role, is developing relationships with other people so that you can learn from them. We don't all have to reinvent the wheel.
Mm-hmm.
But, Jason did support every time I'd go to him and say, hey, I want to get this certification. I want to get that certification. And at some point he said, he made a rule at the organization that we couldn't put more than two initials after our name, two different sets of certifications, because mine got a little ridiculous. And so we did that. But then, wanting to grow and develop in the compliance world, because I like all of the areas that I work in, but compliance is probably my favorite. So wanting to grow in that area, and I came to him at one point a number of years ago and said, I want to go back and get a master's of jurisprudence in health law. And he very much supported that. He would read my papers when I had them. He would he was a great sounding board for ideas, but I knew he believed in me. And he, to his credit, he kept trying to get me to go and get a JD, but I wasn't at a point in my life that I was able to do that. So I would love to, but I don't know if that will ever happen. But yeah, I have invested in a number of degrees and certifications, and the support of the organization has been key to being able to do that.
So Meg, Carrie always makes sure when I tell everybody she went to law school, she has, the little caveat to that, which is to say, well, I didn't get my JD, she got her jurisprudence, but it's kind of funny. We've done that many times. But, I think to Carrie's credit as well, she's also instilled the values of education in her children. And so she has a son who is now a practicing attorney. And so it was kind of interesting because when he was kind of figuring out where he wanted to go for law school, she was going through a similar process, and I think had just started school, if I recall. So it's kind of interesting how it all works. And, to Carrie's credit, she is never somebody who doesn't want to get educated. And I think that's the key with any of us. It's very easy to be stagnant in whatever role we do, or just try and continue on with the status quo. And, I've been lucky that I've had opportunities during my career to go back and get different education and certifications or even degrees. But our entire executive team really, over the past 8 years, they have all also done that on their own. And so whether it's Carrie getting this degree or many of our other team members who've all went back for no reason other than just for self-enrichment, but also to help the organization and really help the different types of, I think, strategic imperatives that we're focusing towards. And it's just something I think we all have to do. And Meg, you and I talked about this, where if we're not constantly learning, then that's a problem, especially in an industry like ours, where it's dynamic and changing every single day.
Yeah. So all of this conversation about learning, we're doing a strengths assessment on our team here, my hospice team here at Husch. And so I just did my Gallup strength assessment, and guess what? I got my top 5. Guess what the number one thing is? Are you a learner? Carrie's holding up her.
Absolutely, I'm a learner. How did you know?
Oh,
you're a learner too, Meg.
My number one strength is learner. And so, and then the second is ideation for me. So I'm all about ideas. And then I think I have intellection, and then strategic, and then responsibility. But I think that culture of learning is really important, because it's behind innovation, it's behind problem solving. And I think that, I guess, something that I've reflected on, and that something I see in strong leadership teams, is that you are not, I guess, threatened by other people's growth, right? That you want to build up other people, and you want really smart people around you. You want people that are going to push you. Like Jason, as a CEO, you want a strong compliance person. And so then you can have conversations, and the give and take that I think really has to happen, whether it's the compliance role or other things within the organization. And I guess I really feel like I want people who are strong, and and they feel empowered and invested, because that's going to make everyone better. And so I guess a long about way getting to that culture of learning, I think, is really a strength when you sort of break down why is Eval great and what's in the secret sauce. I think that's really a big part of that, is you attract people who want to learn and grow.
I agree, Meg. And I think from a compliance officer perspective, anyone in leadership, but compliance is changing so quickly with the regulations and everything happening, that if you aren't a learner and you aren't staying up on what's happening in your field and understanding it, you're going to have a hard time keeping up for yourself and for your organization.
Yeah, totally. And I think there needs to be support for that, because as a person who really loves ideas and thinking about things, and, I always have a lot of ideas. I'm thinking about lots of different things, and that can drive some people mad, but hopefully a lot of people appreciate that, because
the executive team always tells me I have a lot of ideas as well.
So yeah, I guess a weakness of the person with lots of ideas is you can annoy people with all of your ideas, and then they don't know how to prioritize them. But putting that aside, I'm just talking about my own strengths, but that's hilarious that you just did the Gallup strength assessment.
Carrie. I did it a long time ago.
Oh, you did?
I actually, my team went through it as well. We all did it, and then we came together to see what each of our strengths were.
Yeah.
Because it is important to build on people's strengths. So.
Yeah, no, it's fascinating. We're doing a mashup with my whole team, and it's really interesting how right on and eerie, like answering 170 questions is like, that is my essence. How did you
For
figure
sure.
that out? I thought it was more complicated than that, but
No.
I guess on some nuts and bolts stuff with compliance, because a lot of these questions come up sort of operationally of, CEOs don't want to be in the weeds of everything, or at least a good CEO shouldn't, because you got to empower the people sort of underneath you. But like, how did you find your sweet spot in what you share, how much you share, and then, how do you report to the board, and how did you come like to what kind of detail to share, and when you involve different people? And maybe Jason, start with you, like how has that evolved over time, and what details do you like to know versus don't tell me unless something's X?
Yeah. Well, so again, when I got here, I started on the same day as our brand new CFO. So she and I, although we didn't come as a package deal, the organization got us both on the same day. And from there, we had a lot of different executives that were basically kind of towards the end of their career and retiring out at that same point in time. So, although I didn't plan for it, I was given the opportunity to kind of help build out our executive team here. And so, over the course of doing that, and over the course of building out the executive team, as each person came on, we kind of had our own, I think, to your point, way that we were doing things. But in general, Carrie and I meet every 2 weeks and kind of review some high level things. She shares with me all the different reports and things like that she compiles as part of our overarching compliance program and quality programs here at Avow. And it's helpful because I don't always have time to go through the hundreds and hundreds of pages of data that she and her team collect. And our board books are usually 500 to 600 pages for our board meetings. And so, yes, I read all of it. Carrie and I are probably the two people in the organization that read everything. And so one example would be our policies, procedures, and protocols for the agency. She and I are the two people who have read every single one, and
Wow.
that's purposeful to where she's the second to last approver, I'm the last approver. But I think we've kind of found our groove only because, to your earlier point, I have implicit trust in her, not only based on her aptitude and her ability, but really her work product. And so I know that I can trust whatever she's putting together without having to come in behind her and kind of cross check everything and make sure that it's correct. And that's been extremely helpful because, again, going back to when I got here to Avow, for a significant amount of time, probably within the first year or so that I was here, it was myself and the board. And so I was presenting everything, bringing everything to them. And over time, we kind of evolved where now each member of our executive team will come and present to the board for their respective downline, and specifically with Carrie. And so it's interesting because the board actually gets excited to hear from our entire executive team instead of just for me, because they value kind of what Carrie's expertise is and what she brings,
Mm-hmm.
as well as each of our other executives. And it also gives the board an opportunity to ask good questions, which they do for Carrie. And we have extremely high level board members. And I think, Meg, you and I talked about this on
Mm-hmm.
the last podcast that, our board here is a little bit different. And I mean that in a positive way than some other boards that I've either worked for or served on because of their experience. And kind of we have a deep bench, so to speak. And so the person who is the chair of the committee, which oversees quality and compliance, is a retired hospital CEO. And he was at the same hospital for 40 years,
Wow.
basically spent his whole career there and was the CEO for 20. And so he understands everything that we're going through because he's actually lived it. And I think that's something that Carrie enjoys because he asks her the hard questions. He asks me the hard questions, and he does know what a pepper report is, and he does understand floppy and all of these
Yeah.
different things. Whereas that's something that for many others may be lost on them. And so I think to answer your question more directly, it took time to get to the point that we're at, but now we really do have a good workflow, I think, between us and really the way Carrie works with the rest of the executive team and the board, where compliance and quality aren't overbearing. But I think to her point, which kind of kicked this all off, it's really just part of the fabric of what we do here at Eval, because good quality comes out of compliance.
Yeah. Well, and I think importantly, what I'm taking from what you're saying is you value this, you value compliance, and as a compliance officer, I'd imagine, Carrie, that feels totally different. Like if you were working with someone who doesn't really value, like, well, I guess I have to have this because it's like checking a box, I need to do this, as opposed to this is valued, this is critical, this is, it makes for a totally different kind of relationship and how you can really thrive in your job.
Absolutely. It's so important. And it's part of why I do very much enjoy the work is the team that I work with, Jason, but also the other members of the team, and having that relationship where, they don't sigh when I come to the table. But to Jason's point, it did take time to develop. They have to learn to trust that when they share something with me, I'm not going to go run around with my hair on fire.
Yeah.
If there is an issue, we need to deal with it. We're going to do it together as a team, and we're all in this together. And that has taken time to develop. As far as, Jason and my working together and determining, how much to share, that took a little time too, because I didn't want him to feel inundated with all the data. And so there was a period of time, and even now, but less so, I'll send him stuff or I'll ask in our one-on-one meetings, do you want to see this? Do you need to see this? So that we can determine, how much information he wants and needs to do his job. Jason is a very feet on the street. He's not in the weeds, but he knows what's happening everywhere in the organization. And so he does want to know. And one of the things I really value about him is that I can bounce things off him, and he will give me ideas, and he trusts that I'm going to come out with a good answer, but he won't give me the answer. And that is, well, sometimes, but most of the time he makes me work for it. Right. And so that over time has really helped me to develop as a leader and as a compliance officer, because I think things through. And, one of the things we say here at Eval is the answer is always yes. Well, what does that mean? It doesn't mean that everyone that walks in the door, I'm going to say, yeah, you can do whatever you want. But we start with yes, and then say, but how do we get there in a compliant way, so that when they come, they feel like it's a positive, interactive relationship. And Jason and I have that as well. We, bounce things off each other, and, I trust that he's going to tell me if he wants more or less information. He's guided me and coached me and given me more opportunities than I could ever ask for. And in working with the board, some of the ways that he does that are, encouraging me to make sure the board members understand things at their level, and helping me to really recognize when I might be too high level or too in the weeds. But also, I speak fluent acronym, which many of us do in healthcare, but our board members don't always speak fluent acronym. So just remembering that you have to spell it out. You have to make sure that you make the person receiving the message knows what you're talking about. So,
yeah, well, it's clear that you two have a relationship of trust, and that it's evolved over time, right? I mean, trust, I do think, is earned. Not that you are untrusting initially, but right, over time, when people deliver over and over again, as you're saying, Jason, your need to sort of read everything, it becomes less, right? I mean, because over time, and so I feel supported when you're around really talented people that you can trust, because it just, you sleep better at night, and you do feel like we're all really in this together, as opposed to, well, that's your problem. That's compliance, or you figure it out. And so I guess sort of last question as we wrap up here, what do you value most, Jason and Carrie?
That is a tough one, Meg, because not to sound somewhat cliche, but there's so many different things. I think really what I would say I admire about Carrie is just the tenacity in which she does her work, and her expertise in it. And candidly, and I probably don't tell her this enough, but sometimes when I see some of her work product, as dry as that sounds, I'm kind of excited because she does such a good job with it, and not just the details in it, which are all exceptional, but also just the presentation of it, and when she puts together things for the board. And so I just, again, would really admire her tenacity, and she has accomplished a lot of the things that she's accomplished that I've witnessed personally over the past 8 years. In terms of working full time, building an entire, or I should say, revamping an entire compliance and quality program, going to school to get another master's degree, getting multiple certifications, while also being an exceptional mom to her 3 kids. And so they're all things that I think anyone, including myself, could only aspire to. And she sometimes, as well as many of our other peers and colleagues, inspires me just because she's able to do all of this. And sometimes I think I could never do all that. I don't know how she does it, but she does it.
Yeah, I'm doing one of those things, right? Yeah. But I guess, Carrie, you're going to have the last word then. It's going to be mic drop after you here. But I guess what do you value most about Jason, and has that evolved over time?
Yeah. Well, first of all, thank you for your kind words, Jason. I value our relationship. There are so many things I value about Jason and really respect about him. And there's the work, and then there's the personal. And Jason is really good at the boundaries between the two, which is something that he has taught our team and our leaders, which is important from a compliance perspective as well, because you have to be careful with relationships and things especially when you're at a higher level. But the work-life balance is something that I have struggled with, because I do want the next certification and the next degree, and so I work, and so Jason would say, Carrie, stop for a minute and see the whole world. Where's the balance here? And when he does that, he knows that I might be spending less time at work, but he also knows that it's better for me and for the long-term future, my career, and for the organization. And I very much value that about him and about our relationship. From a business perspective, Jason is a strategic thinker. And from the beginning, he got me to think about things on a larger scale, but also not at the micro level. And I might say, well, this is what we need to do. But then he would help me see, yeah, but what does that affect? What's the cascade here? So he really thinks about the future. He sets the organization up for success in the future, but he does the same thing with his employees. And I've seen, and it takes time in working with someone to see this, how he has developed each member of the team individually to really build on their skills. And he has helped me become a better leader and really a better person with the balance in my life because of the strengths that he has.
Mm-hmm. Yeah. Wow, that's powerful. And that's hard to do.
Yeah, it is.
And it's way too much credit. Let me just say, she's giving me way too much credit, Meg.
Well, I doubt that, but I mean, because I think it's hard, and it takes time and it takes patience. But when you sort of have the long view to things and investing in people and giving them what they need, and that how and what they need changes over time, and so I think you need to be tuned in to, because not everyone needs the same stuff from you. And so, well, that's fabulous. You guys are fabulous in doing great things. And, it's fun to see how, even since I've known you, how you've changed and evolved, and you're both very smart people. So I appreciate you sharing, how you've come to be a bit more. You didn't reveal all the secret sauce here, so there's no like, oh, this is exactly how Jason and Carrie. So, another podcast maybe in our future, so I can get you to because compliance keeps changing over time, and what audits you do, and the mix of proactive versus reactive stuff. It's sort of relentless because right now people feel so overburdened by all of the reactive audits that I'm concerned a bit that we forget to focus on our game too. Like, the government's going to audit you no matter how perfect you are, right? And so it's just like how not to let that distract you from, so Jason doesn't get distracted by that and can still grow the business and grow people and all that stuff. And Carrie, you still have your proactive compliance plan that you need to do, even though we need to react to these things. And so I think having strong, talented leaders and really good infrastructure allows you to react to things, but not make that your business plan. That's all reactionary to everything, as opposed to, well, what do I want to accomplish? Because you can have days where you don't accomplish what you want, but if that becomes months and years because you get in, that is the death of an organization, right? So I think you guys have done a great job of striking that balance. And so I'm inspired by what you all do. So anyway, this was fun as always. So thank you for making the time for me.
No, thank you, Meg. Appreciate it.
Well, that's it for today's episode of Hospice Insights, The Law and Beyond. Thank you for joining the conversation. To subscribe to our podcast, visit our website at hushblackwell.com or sign up wherever you get your podcasts. Until next time, may the wind be at your back.